Welcome to the City of Toronto Children's Services Pre-Opening Operational Tips and Considerations module. Within the reopening stages, there are many operational pieces to consider. This module will support you in thinking about how your program will operate on a day-to-day basis. In this module, we will be discussing where to start when updating your policies and procedures. This could mean updating existing policies or creating new policies that will assist you in fully meeting the provincial and local guidelines. We will then move on to staffing and what you need to consider when thinking about how staff will function in the environment. To finish, we will discuss communicating with parents and families. It is important to note that before you update your policies and procedures, you should read and understand the Provincial Operational Guidance during COVID-19 Outbreak document and Toronto Public Health Guidance document. You should have also reviewed and understood the IPAC Practices module, which will inform what should be included in your policy updates. Toronto Early Learning and Childcare Services will be making all their policies and procedures available on the city website. In the meantime, here are some things to consider. You will be required to submit an attestation to the ministry that confirms new health and safety policies and procedures have not only been developed, but also reviewed with employees. Those policies will include sanitization of the space, toys and equipment, how to report illness, how physical distancing will be encouraged, how shifts will be scheduled, rescheduling of group events and/or in-person meetings, and parent drop-off and pickup procedures. During this time, you should review all existing policies and procedures to ensure they meet the revised ministry and public health requirements. When reviewing, consider the following processes. Hand hygiene. How often are children and staff washing their hands? You may want to consider, at the very least, having children and staff wash their hands upon arrival, before and after eating, after toileting routines, upon return of playing outside, and after any type of creative learning experience. Environmental cleaning. You will need to establish a cleaning procedure for your program space. We already discussed toys and play material, but what about frequently touched surfaces? Frequently touched surfaces, such as doorknobs, light switches, and toilet handles, must also be cleaned and disinfected at least twice a day or more if visibly soiled. It is a good idea to review with staff which surfaces in your program space are considered frequently touched to ensure that nothing is missed. Keeping a cleaning log or a checklist may be useful. If your program rooms will be sharing the washroom, each cohort will need to have a designated washroom routine time as they cannot use the washroom at the same time. Also consider who will clean and disinfect the washroom in between uses. Meals and snack time. There should be no outside food provided by the families unless there is a special requirement. Consider contacting your food service delivery to ensure they are still operating and have sufficient supplies to meet your menu needs. Also think about how they will drop off the food containers to the center. Will they drop off the containers at the main entrance? If they are coming into the center, they will need to be screened and logged in your record book. Formula bottles and/or food brought from home will need to follow directions from Toronto Public Health. Food should be served in individual portions to the children by the educators. Children are no longer serving themselves any foods or condiments. The educators will also need to ensure the children are not sitting close together during meal times and that they continue to adhere to physical distancing expectations. Children should not be participating in any type of food preparation, and this includes cooking learning experiences. Visitors. There should be no non-essential visitors to the program. This includes volunteers and students. If your normal programming includes an enrichment program that includes a community member, this will need to be put on hold for the time being. So who can enter the building besides the staff and children? Special needs resource educators, ministry staff, and other public health officials. Anyone entering the building will need to be screened. Consider how this will affect your staffing. Will you need a permanent staff to cover the screening area? One of the most important procedures that will need to be implemented is the attendance tracking. Childcare programs will be responsible for maintaining daily records of anyone entering the facility and the approximate length of their stay. This includes cleaners, people doing maintenance work, people providing supports for children with special needs, and those delivering food. Develop a process that records the name, contact information, time of arrival and departure, screening completion, and result. These records must be kept up to date and available on site for at least 1 year to facilitate contact tracing in the event of a confirmed COVID-19 case or outbreak. As we transition to reopening our program spaces, it's important to consider what your staffing needs are, as well as the well-being of your staff. Let's take a look at the things you need to consider around staffing. One of the big considerations as a supervisor is planning your staff complement and what will it look like going forward. Consider how many staff you will need to operate on a daily basis. Things to think about are: how many staff per program room will be needed to maintain ratio? You will not be able to have an opening and closing room where all the children gather at the beginning and end of the day, as children need to remain in their designated rooms throughout the day. Therefore, you need staff for each room from the opening and closing of the center. How will staff take breaks and lunch? Remember that staff are not able to go to different rooms to cover breaks and lunch. Each room will need sufficient staff within the room to cover all these functions. What if a staff calls in sick? Do you have access to additional staff? Do you usually use a supply or casual staff agency for coverage? As staff can only work at one location, that staff should be assigned to one specific cohort and should not mix with other rooms or cohorts. Before welcoming staff back into programs, consider what training they will need. This includes, but is not limited to, the training that Toronto Children's Services is providing related to IPAC, PPE, and screening. Staff may also be experiencing fear or anxiety around returning to work and being exposed to the community. Consider how will you support their mental health and well-being. Are there resources that you can provide beforehand? Once the staff are back to work, staff may exhibit a decrease in morale or exhibit feelings of isolation. This may occur since staff are unable to mix with other program rooms, may not be able to have lunch with their colleagues, and could be feeling overwhelmed with the new expectations. Think about how you can support staff morale and engagement, keeping in mind that traditional activities such as potlucks are no longer possible. Check in with your staff often and ensure everyone has what they need to feel safe and comfortable. Let's think about families and how we can engage them moving forward. Communicating with families. As you can imagine, communication will look a lot different as parents and families are unable to enter the childcare center. Think about moving to an online platform where you are able to share daily information with families about their child's day. If you have new families joining the center, consider having virtual meetings or tours with the families, and you can use the same platform if you need to meet with an existing family. New policies should be shared with families for their information and to ensure they are aware of these expectations, such as keeping children home when they are sick and not having access to the main center building, which are aimed at helping to keep all children and staff safe and healthy. This too can be done virtually, allowing families to ask any questions. Consider sending families pictures of the program spaces so that they are able to see where their child will be. Pictures of educators in personal protective equipment can also be sent home prior to the children starting in the program to alleviate any potential fear or anxiety. Let's finish by saying this is a new experience for everyone involved. Preparation, flexibility, and training will assist you in a successful reopening. This quote from Charles Darwin puts things into perspective. The most important factor in survival is neither intelligence nor strength, but adaptability. This concludes the Operational Things to Consider Part 2 training module. If you have any additional questions, please contact your district consultant or email qualityassurance@toronto.ca. Thank you.